Hello everyone. Today we are going to discuss the cancer of cervix. Yesterday we had seen the introductory topic that is cancer of vulva. Now today we are going to discuss about the CA cervix. CA cervix or the cancer of cervix, it means the malignant growth of cervical epithelium or cervical tissue. In the cancer of cervix, the incidence is about 30%. Females are affected with this CA cervix, and usually etiologically the basic cause for cancer, any cancer, is not known, but probable causes are because of the age factor, as cancers are seen in advanced age. So mainly it is seen in advanced age. Mainly cancer of cervix is associated with sexual history. Patient who are sexually active, those patients are more prone to have this CA cervix. It is less commonly seen in patients who are nulliparous and who don't have any sexual history. So mainly sexual history, age factor, patient with prolonged hormonal therapy, patient with previous history of any cancer in her body, patient with viral exposures or viral histories, in viral infection histories, especially STDs or herpes zoster, repeated attacks of these viral infections. Those females are more prone for this CA cervix. So these are some probable causes which can be associated with this cancer. Also nowadays dietary factors, lack of exercise, lack of sleep, and many emotional and psychological reasons are associated with this cancer. Dietetic factors are commonly seen. Patient with history of alcohol and smoking, those patients are also having the more chance for cancers. So these are some etiological factors for CA cervix. Family history is also one of the cause which can be seen or which is associated with this CA cervix. Patient with cancerous history from her maternal side is also associated. So these are some factors which are seen with cancer of cervix. Incidence, as we had seen, 30% of female cancers are cancer of cervix. Because of the investigative things and pap smear and other things, nowadays these cancers are detected at early stage. So prognosis of cancer of cervix is about 70 to 80% increased because of the detection at early stage. Mainly in India, this cancer of cervix is seen in younger age, and as compared to European or other countries, it is commonly seen in patient at the age group of 50 to 60 or less than 50. In other countries, more commonly this age group for CA cervix is above 60. But commonly it is associated with the advanced age, along with some high risk factors, dietetic history, a patient with history of drug, alcohol, and sexually active patients, family history of cancers. These are the some etiological factors of CA cervix. Now pathology of this cancer of cervix. Pathologically, cancer of cervix is associated, or it is seen, this cancerous growth is seen in two cellular layers, that is squamous cells and columnar cells. Whenever there is involvement of squamous cells in the cancer, then there is a squamous cell carcinoma, or we call it as exocervical cancer, because this cancerous growth, usually the squamous cells are, anyway the squamous cells is external layer and columnar cell is inner layer. So whenever there is involvement of this squamous cell, that cancer is called as exocervical because it is on the external surface of cervix. This cancer can be detected at early stage because it is externally visible. So that is exocervical cancer, that is involvement of squamous cell. In this type of cancer, exocervical cancer, there is multiplication of the squamous cells, and there is because of this multiplication there is formation of ulceration and induration of surrounding tissues, and there is invasion of underlying tissues. This cancerous or malignant growth invade or perforates the surrounding and underlying tissue and forms a growth which is like a cauliflower growth, and this can be seen on external examination. This cauliflower-like growth is very easy to break and very easily bleeds on touch, and it have offensive discharge, as it is commonly seen in any other malignant growth. So that is exocervical cancer. This is involving squamous cell and seen on the external surface of cervix. Second type is columnar cell cancer. These are the inner layer or inner lining of cervix. So whenever there is involvement of columnar cells, there is also multiplication of these columnar cells, but at it is in the inner aspect of the cervix, or it is the underlying tissues. So this growth is not easily seen, and it just changes the shape of cervix. Cervix becomes barrel shaped. It is enlarged in size. There is also induration, but ulceration or the malignancy formation is on the inner layer of cervix. So there is change in size and shape of cervix, but it cannot be seen at the early stage. It can be detected in advanced stage. So pathologically there are two types of cellular involvement, squamous and columnar. So squamous is external, exocervical, and columnar is endocervical. It is on the inner layer of cervix. Squamous is like a cauliflower-like growth, and in columnar, cervical shape becomes barrel-like. So this is about the pathologically, just in short introduction of cancer of cervix. Secondly, as yesterday I told you the format for the cancers. First of all, you have to write the definition, then you have to write incidence, etiology, and then pathology, then spread of cancer. So coming to the spread of cancer of the CA cervix, as usual, CA cervix or any cancer spreads by two ways. Either it spreads by direct or indirect. Whenever there is direct spread, that means there is spread of this cancer to surrounding organs. Now surrounding organs of this cervix is, first of all, it is uterus, then fallopian tubes, then ovaries, urethra, ureter, bladder. So all the surrounding organs are affected, and this cancer can spread to these surrounding organs by direct method, or direct spread it to surrounding organs. In indirect spread, we had seen the indirect spread takes place by lymphatics and blood supply. So lymphatics are usually external iliac and hypogastric lymph nodes are involved, and those lymph nodes which have common drainage that spreads to cancer to that organ. So it can be spread to abdominal organ as well as in the other things in body. By blood spread like common iliac artery and other blood supply which have common drainage, like it can spread to lungs, kidney, liver, spleen. So this cancer can be spread by indirect way and direct way. Direct to surrounding organs, indirect by blood and lymphatics to anywhere in body. So this is about the spread of cancer. Next we have got clinical features of this CA cervix. First of all, in any cancer, patients are asymptomatic. Cancer is the thing where there are no complaints. Just if patient is very alert and health conscious, patient can notice about the weight loss, loss of appetite, or sometimes weakness, giddiness. So these general complaints can be seen, but otherwise cancers are usually silent. But in some patient, if at all there are complaints, then the important complaint is per vaginal bleeding. As we had seen, the patients are of advanced age, so patient does not have usually clinical history of menstruation. If at all patient is on regular menstruation, she will complain of there is irregular menstrual bleeding. If patient is at menopausal age, she will give history of postmenopausal bleeding, per vaginal bleeding. This bleeding is usually offensive, dark colored, and it is irregular. Patient, if she is having her menstruation, then patient may have metrorrhagia, menorrhagia. Sometimes there is spotting or irregular type of bleeding. Sometimes there may be PV bleeding even after exertion, even after any moment, or because of the during examination, PSPV examination, after sexual relations. So there is PV bleeding by many factors, and this bleeding is usually irregular and usually dark colored with some smell, offensive it is. Secondly, second complaint will be per vaginal discharge. She may complain of offensive, foul smelling discharge per vaginal, which is usually blood stain, and it have got particular smell. Next is there is pain in abdomen, pain in lower abdomen especially, and sometimes pain during urination. There may be backache, pain referred to knees, legs. Sometimes it depends, pain depends on the spread of cancer. If cancer has spread to abdominal organ, patient may have pain in abdomen. If cancer is spread to urinary organ, patient will have pain during urination. So pain is depending on the spread of cancer. But patient may complain of lower abdominal pain, which is very common, and sometimes pain referred to knees and lower extremities. So this is regarding pain. Next, patient will have cancerous patient usually have a low grade fever, constant fever they have. So patient will complain of body ache, malaise and increased body temperature. These are the important complaints. And as I told before, patient will have loss of appetite, loss of weight, sudden loss of weight and loss of appetite. These are the symptoms. Giddiness, weakness, constant feverish feeling. These are the things which can be noticed during the CA cervix. So these are some symptoms from patient. Signs on examination. Usually there are signs of anemia in any cancer. We have got the signs of anemia. So pallor, clubbing, icterus, all the signs of anemia we can see. Per abdomen examination is usually normal because the cancer is on the lower aspect. So we have to do PSPV examination. On PSPV examination, we can, if the growth is squamous cell or it is exocervical, we can see the cauliflower-like growth on examination. This growth is friable. Friable means it easily breaks on touch. It easily bleeds on touch. This growth is fixed. Malignant growth are always fixed. They cannot move from side to side. Non-malignant or benign growths, boils or any other growth which are non-malignant, they can move from side to side. So this growth is fixed. So it is fixed, friable, indurated and it easily bleeds on touch. So we can see the cauliflower-like growth if it is exocervical. If it is endocervical, on PSPV examination, we can see the changed size and shape of cervix. Cervix is enlarged, indurated and there can be bleeding on examination. So these are the things which can be seen, and patient can be easily diagnosed on clinical aspects because of the age factor, because of the history and because of the growth and because of the PSPV examination. But for confirmation we have to do some investigation. So investigations for CA cervix, basic investigations we advise, nowadays we advise pap smear, which is very common investigation. Before that we have to advise all the basic blood and urine examinations test, and then we advise pap smear. PSPV examination is also included in investigation because clinically we can easily detect the cancerous patient. So after PSPV examination we advise that patient for pap smear, then biopsy. If necessary, we advise for CT scan and MRI. But usually these cancers are easily detected by pap smear. And for knowing the exact staging of cancer and for the spread of cancer, we advise scan and MRI. So these investigations we do for cancer of cervix. After that, we have got this staging of cervix. Also in investigation, nowadays we advised colposcopy, hysteroscopy, cystoscopy. Because of the spread of cancer, we do all these investigations. And after that, staging of CA cervix. Staging, as in every cancer, we have some staging method. In Gyneac, yesterday also we had seen there is FIGO staging, that is International Federation of Gyneac and Obs. They had given the stages of cancer. So FIGO staging of the CA cervix. According to this, stage 0, that means very initial stage where the cancer is in situ. That means cancer is present only in that cellular layer, whether it is squamous or columnar, but that cancer or that malignant change is limited or it is only seen in that cellular pattern or in that cell. So cancer in situ, we called it as cancer in situ, cancer in the cells. So that is CA in situ, that is stage 0. It is very early stage. Now stage first. Stage first is the cancer which is limited to cervix. That means cancer is limited only to cervix. Cancer is present on the cervix. Stage first A. In that first A, that means it is microscopic lesion or it can be diagnosed only by microscopic. So it is very small lesion. Stage first A1, in that it is minimal microscopic lesion. That means it cannot be measured. It is minimal microscopic. Stage first A2, that means it can be lesion is microscopic but it can be measured, and measurements are 5 mm, it is deep depth is 5 mm and horizontally it is 7 mm. So the patch of that malignant growth should be 5 mm deep and 7 mm in length. So that is first A2. First B, stage first B is lesion more than 5 mm in depth and length is more than 7 mm. That lesion we called as first B stage. So that is about the staging up to first stage. Now this is the substaging of cancer of cervix, because the cervix and the layers of cervix are very crucial. So we have got different types of stages, and stages are very minute. Stage 0 is limited to cell, it is called as CA in situ. Stage first means cancer of cervix. Now this cancer is limited to only that cervix or particular area, cervical area is affected. In that stage first A, it is microscopic lesion, it is very small lesion. First A1, it is minimal microscopic, cannot measured. First A2, it can be measured and the measurements are 5 mm deep and 7 mm length. And first B is lesion more than 5 mm depth and 7 mm length. Now stage second, in second stage cancer is out of cervix, cancer beyond the cervix, but it is within the pelvic cavity. It reaches to vagina, involves the lower 1/3 of vagina. Stage second. Stage second A, there is no parametrium involvement. Stage second B, there is parametrium involvement. So this is about stage second. Second stage, cancer out of cervix but within pelvis and reaches up to vagina. That means spreads to lower direction and involves up to lower 1/3 of vagina. And in that second A is no parametrium involvement, and B is there is parametrium involvement. Stage 3, that is cancer up to pelvic wall and up to lower 1/3 of vagina. Third A, it is lower 1/3 of vagina but no extension on the pelvic wall. Third B, extension up to pelvic wall, that means involvement of the pelvic organ. Kidneys and ureter involvement start at this stage. So stage 3, it is cancer beyond the pelvic wall up to lower 1/3 of vagina. Third A, lower 1/3 of vagina but within the pelvic, on the up to the pelvic wall. And third B is extension on the pelvic wall, involvement of urinary organs. Stage 4th is cancer out of pelvic cavity, spreads in the abdomen and spreads in the body also. Fourth A is spread to adjacent organ like pelvic organ, abdominal organ, and fourth B is it has spread on distant parts of body, spread in the body like kidney, liver, spleen, any organ can be involved. So these are the stages. Important stages are 4 stages. First is limited to cervix, second is out of cervix but within pelvis, third is pelvic organs are involved, and fourth is in all the organs or spread is distant. That is last stage, 4th stage. So this is about staging of CA cervix. Now depend on this stage we have our line of management or line of treatment. So management of CA cervix, treatment of CA cervix. As we had discussed yesterday also, whenever there is involvement of or malignancy of particular area, we can treat that patient by surgery. But whenever there is involvement of lymph node or vague organs are involved, surgery cannot be performed. Patient have to be kept on chemotherapy and radiotherapy. So for stage 0 to stage 1, patient can be advised for surgical treatment, and surgery is extended hysterectomy, or it is called as Werthin's or Mitra's surgery, where there is removal of cervix, uterus, vagina, fallopian tube, all the organs are removed along with lymph nodes. All the pelvic lymph nodes are removed. So that is called as extended hysterectomy. In that the ligaments of uterus are also removed with lymph nodes. and the surgery is followed by chemotherapy and radiotherapy. So this can be indicated for stage 0 to 1, and after second stage, as cancer is in the pelvic cavity, and after that patient has to be given chemotherapy treatment and radiations. So this is about the treatment of CA cervix. So in short, CA cervix is the cancer of cervix, usually seen in advanced age patients, sexually active patient with drug history, alcoholic history, smoking history, psychological reasons, dietetic reasons, and family history. Pathologically, two types of cells are involved, squamous and columnar. Squamous is exocervical, external cancer. Columnar is endocervical, internal cancer. Clinical features are patient will have bleeding, PV bleeding, discharges, pain, and common symptoms of cancer. On examination, we can see if it is exocervical, we can see the cauliflower like growth, which is fixed, friable, indurated, bleeds on touch. If it is endocervical, the size and shape of cervix is changed, it is barrel shaped. Investigations are all the routine investigations for cancer, and pap smear, hysteroscopy, CT scan, MRI, biopsy. Important is biopsy for knowing the exact layer of involved layer, cellular layer. So cervical biopsy, and staging, stage 0, stage 1 of cancer, stage 2 about the pelvic cavity, stage 3 out of pelvic cavity, and stage 4 it is distant spread. Depending on staging, we have got the line of treatment. Early stages surgical treatment, and for later or advanced stage, we have got chemotherapy and radiotherapy treatment. Chemotherapy means we give the tablet forms which are anti-malignant tablets. Those are given, those have got various side effects. And radiations means the radiation of particular heat waves are passed, and radiation treatment is advised depending on the stage of cancer. So that is about CA cervix.